Welcome back. We're following several health-related stories this afternoon. To help us break it all down is Dr. Jeff Potoff from UW Health. Doctor, thanks for being with us. Let's start with the former president's cancer diagnosis. How do you detect this illness?
Yeah, so most men will have screening with something called a PSA or prostate specific antigen. And if that antigen starts to get too high for their age, it can lead to follow-on testing, whether it be MRIs or physical exams, biopsies. As people get older and prostate cancer being such slow growing, the recommendation to continue PSA actually goes away when you're in your 70s. So that could make it a little bit harder to detect. We don't know if I don't know if President Biden was having PSA screens, but it is possible then that you could detect it when someone has symptoms. So inability to urinate the way that they'd want to, sometimes bone pain could raise questions that would have doctors look into like what's causing those symptoms, and they could diagnose it at that time.
A couple more questions on this. So you're saying it is slow growing. I mean, it means it could have been there for years and not diagnosed if there wasn't those tests you're talking about?
Yeah, it could have been there for years, and then about 6% of prostate cancers can be detected in kind of the scenario that we're seeing with President Biden, where folks didn't necessarily know that they had it. It came on relatively quickly, more aggressive forms, but only about 6% of the time. About 94% of the time, these things are slow growing, could be picked up if folks were looking for it.
They say this is aggressive, but it can be treated. But at his age, at 82, the treatment itself can be pretty difficult.
Yes and no. So for cancers like this, oftentimes things that are, say, more difficult, i.e. like surgery or kind of classic chemotherapy, can be avoided. Instead, they use medications that really impact testosterone. These cancers are very sensitive to testosterone. If you decrease testosterone, you can make these cancers just pause where they don't get any larger, or sometimes even shrink down. Now, that therapy typically doesn't last for forever, but it could keep this at bay for 5, 6 years without this cancer getting a whole lot worse if his cancer is susceptible to these hormonal therapies.
All right, thanks for breaking that down for us. We just had the largest one-year decline when it comes to overdose deaths ever recorded. What's working when it comes to bringing these numbers down?
Yeah, this is great news. 30,000 less overdose deaths in 2024 compared to 2023. And if we look at what initiatives are driving this down, a lot of them are all focused on public health. So a big one is the ready availability of Narcan in our communities. It's not, you don't need a prescription for it anymore. There's vending machines. It's out there in the community. That can be life-saving for people who are experiencing an overdose. Likewise, there's more addiction treatment available. Some of this coming through public health departments, some of this coming through the lawsuits that against pharmaceutical companies that promoted opiates that now is funding this addiction treatment. And then the last thing is education. We are having more of our young people realizing that doing drugs is really a bad idea. And thankfully, they're avoiding that. All these things together are driving some pretty impressive changes, reductions in overdose deaths. We're not done yet. 80,000 people dying per year of overdose, not okay. We got to do better.
Speaking of children there, we know that exercise is good for your physical health, but also your mental health as well?
Absolutely. We've known that exercise really is almost a treatment for depression. This study looks at children, about 16,000 of them out of Sweden. It looked at kids that, were like 8 to 11, 5 to 11 years old. And for 11-year-olds, every hour per day that they exercise, their risk of developing any mental health condition by age 18 down 12% per hour of daily exercise. This difference was more in the boys than the girls, but a really good reason to potentially involve our kids in sports or at least physical activity at a young age. It actually wards off mental health problems as they get towards adulthood.
All right, Dr. Jeff Potoff with UW Health, thanks for being with us this afternoon. We'll see you next week.